Now, the 24th Annual Conference of the Association of Medical Councils of Africa, hosted by the Health Professions Council of South Africa, has officially started in Rustenburg. The conference, held under the theme The Health Workforce of the Future and Its Regulation, will be taking place as of the 2nd, which is today, of October to the 5th of October. The aim of the conference is to facilitate dialogue that will provide an effective healthcare sector by supporting best practices, innovation and knowledge sharing in the interests of public safety. Our reporter Tebogo Phakedi has more on that.
This conference really is seeking to make sure that all health professions across the continent do converge to discuss different challenges, to discuss different policies, and of course any other things that would then be related to their industry. We did speak to several doctors here in the Northwest Province who would know that really the health sector has been hit hard, more so especially after COVID. But I can tell you also that the ongoing load shedding being one of the challenges. When we spoke to some of them, they were saying that the other issue of a lot of people being unemployed, you would know that many of them would then lose on their medical aids, meaning the private sector will be losing the clients to the public sector. Now, those doctors were saying some would not even get the medication they would anticipate to get, chronic medication, leading to many people now defaulting on their medication because of that. But to just talk about the main goal of this conference, what it seeks to achieve, I have with me the president of the Health Professions Council of South Africa, that is Professor Simon Nemu Tandane. Thank you so much for your time. Just tell us what this conference, the 24th Annual Conference, seeks to achieve.
Well, this conference, as it has been publicized all over in Africa, it's going to bring along health practitioners all over Africa to work on the health workforce for the future and its regulatory bodies. That's what this conference is all about. It's an annual conference where South Africa, through Health Profession Council of South Africa, it's honored to host delegates from all over Africa that will be gracing this occasion as from today until Thursday.
We understand that you are hosting over 20 African countries, and when we zoom into South Africa, really, if we use that as a case study, we know there are many challenges, load shedding being one of them. We had the minister on Friday saying some hospitals will be exempted from load shedding, but the view is that all clinics, all hospitals should be the case. If you can just touch on that and other challenges you are experiencing as professions.
Well, as we have issued a statement in the media, the Health Profession Council of South Africa is calling upon ESCOM to make sure that all health facilities, be it public and private, clinics all over South Africa, should not be under load shedding. That has a negative impact on our service delivery. As you are aware, most of the institutions don't have generators. The diesel is very expensive, so some of the facilities, they run dark and patient cannot access health services. That is the main clarion call that we are making to the Department of Health, and we are happy that the minister has made that call to make sure that all those facilities should be exempted. But they are just a drop in the sea. As you know, there are not so many of them. It's less than even 10% of the whole facilities in South Africa.